Acupuncture is one of the many tools that's part of the classical Asian medicine set of healing arts. So acupuncture is a therapy that's been around for thousands of years, literally, and has been developed in ancient China all the way up through the modern world. Acupuncture theory really began in books about 2,500 years ago and has been developed consistently over the centuries until it's a highly refined form of medicine used throughout much of the world today. The first thing that happens when a resident walks in the door is we have a conversation that gives us a chance to talk about anything the resident is going through, whether that's physical pain, such as back tension, shoulder pain, neck pain, etc., or whatever the resident is going through on a psycho-emotional level, working through trauma, depression, anxiety, and anything related to inner health, be that the health of the organs, diseases, conditions a person might have. All of those things can become very relevant when working with a traditional Asian medicine practitioner. After the initial conversation, we will go into the treatment process, and that's going to look different for every single resident. That might include things like physical body work, which is similar to medical massage. It might involve pressing a number of points on the body. That could also include acupuncture, which is a form of using needles therapeutically. And it might include a number of other tools like craniosacral work, energy work. One of the most immediate benefits of acupuncture is relaxation. It's also the most immediate side effect of acupuncture is relaxation. Quite often when I'm seeing people in my private practice, I'll let them know to wait a little while before they walk out the door and go to their car, because people often find themselves in a very different state of mind. These are medicines that can quite literally put somebody into a different state of consciousness. And I've seen everything from people falling asleep on the table to people having fully fledged visions, really, of things far away, dreamlike states. And so acupuncture has a profound effect on changing things on a psychological level, on an emotional level. One of the main things I like to talk about is that acupuncture is a mind-body medicine, meaning that it works both on the physical level as well as the mental and emotional level, and really everything in between. Because the scope of what acupuncture can treat and what acupuncture can affect is rather broad. Acupuncture can treat everything from physical conditions such as shoulder pain, back pain, knee pain, what have you. Acupuncture can also treat internal organs, things that are going on with the human system, whether that's digestive issues, lung issues, viruses and things people contract. All of those kind of things can respond well to these medicines. In addition to that, there is the entire psycho-emotional realm, the states of being that a person finds themselves in and the blockages that might come up to that, which can manifest as things like depression, anxiety, etc. By doing strategically placed acupuncture points, it has an effect both on the psyche as well as on the physical body, because people often come to these doors with both a combination of physical things that they're experiencing as well as mental, emotional states that they find themselves in, and of course the need to work through past traumas. From the Asian medicine point of view, these things often come together. Where we store stress in our body can say a lot about us. If people are always putting stress in their shoulders, it might raise the question, what kind of burdens are you shouldering in your life? If people place stress in their low back, might ask questions like, well, what is the support? Is the back as the pillar of support in your life? How might that be strained? So where people find stress on a mental emotional level quite frequently shows up in a very strong analogous way, if you will, to the physical realm. Fear of acupuncture needles is very common. I had a fear of acupuncture needles before I ever got acupuncture. And one of the things I'll often tell people is that acupuncture needles feel very different than any other kind of needle you've ever had. For one thing, they're very thin. They're maybe about as thin as a human hair. So if you imagine a syringe or a vaccine, if people have had that kind of medicine before, that's a very different sensation. It's often painful. Acupuncture needles are a completely different kind of sensation. And it is possible to experience all kinds of sensations during an acupuncture session, whether that's a slight feeling of soreness, like getting a deep massage, or some people feel a feeling of electrical current, or maybe a feeling of flow, like in the circulation of their body. All of those things are possibilities. It's also possible that people feel nothing at all. One way or another, we always want to make sure that our clients have the best experience possible. So that's why when people come see me, I always like to talk about whatever people have as their concerns, whether that's needles themselves, whether that's physical touch, whether that's any other health concern they might have or question they might have. Those are very important things to go over on your first visit with your provider. So those are the kind of things that we can talk about and make the experience as comfortable as possible. Quite often when I'm seeing people for the first time, I may start in a slower way, maybe doing fewer needles or maybe introducing the therapies one at a time so that people can gradually accommodate to the experience. However, some people might be ready to dive into the whole experience, and it just kind of depends on a person-by-person basis. So we're always going to adapt these medicines to the individual's needs, and that becomes a really important part of our conversation with the residents here.